I'm Kim Vig. I was born and raised in Brookings, and I'm an instructional designer at South Dakota State University. And this is my husband, John.
Hi, I'm John Vig, and I also reside in Brookings, of course, and I've been working at Larson's for quite a long time now in Brookings. So I knew I was up for a second one, actually, and for my 5-year one, for the 5-year one, and she was due for 10-year one, she had told me. So, hey, she said to me, let's see if we can schedule them together.
I kind of said it half jokingly last fall. I'm like, well, if we're both due, maybe we should just do a couples colonoscopy and get it done. And I was kind of half joking. And then we're like, why don't we? Why not do it together? And it just worked out really well. We just made the best of it. I mean, it's like, you have to do it. It's not a big deal, but it's still, if you're doing it by yourself, you know, if he was laying on the couch watching football and I'm trying to chug all this stuff, he wouldn't have had any empathy or anything. So we're doing it together, and especially, you know, we're literally doing cheers and getting our dog excited.
Getting music,
to do cheers,
pumped up the music on the,
dancing, and, you know, the last few chugs were the hardest, and we really cheered each other on then. But I'm like, God, people probably never laughed this much doing prep before, and we were sending updates to the kids on Snap, but we had a lot of fun with it, because why not? I just like her demeanor. She's very calm and matter of fact in something that can be a little awkward. You know, you're talking about your colon and different things, and she's just matter of fact, tells you how everything will go, what could go wrong, you know, but she's just I really like her, and she explains things really, really well. But she's a very calming person.
Yeah, calming presence. That's what I would say about her.
Again, they're just so, from the moment you walk in, it's just, you know, good morning. It was early in the morning, and you wouldn't have known it when you came in. And I like that they knew we were together, and so they welcomed us all together, but then they talked to us as individual patients. And so I really liked that part, that even though we were there together, we were still individuals that were having procedures done. Because at the end of the day, it's still a procedure.
Yeah, very personable. You didn't feel like you were just a number or a name, you know, you were somebody, like she said. So when I woke up, I didn't realize that they had actually done it. And I remember that from the first time I had my colonoscopy too. So
in recovery, we just kind of took the rest of the day as a day to lay around. I mean, neither one of us had any. From the moment we left here, there was no discomfort. You don't need anything after you go home. You're just hungry. I really wasn't concerned with anything, and so she just said, you know, I found a polyp. I expect it to all be fine. They'll send it off anyway. And then she showed me pictures of everything along the way, and you know, what they found, and it was surprising, but again, she said not a major concern unless they sent it in, and we both got letters the next week that everything was fine, and it was on our portal, so we knew that before we even got the letter.
That was the other thing with Dr. Wee. She asked me if I had any questions, of course, which I'm sure she did with you, and she remembered that from doing my colonoscopy the first time that I had a polyp, and so she obviously did her homework, so to speak. She checked my chart and was prepared to answer that. The follow-up was fantastic. They made sure we had a great experience. I mean, that's kind of what it's about too. I think, you know, they want to make you comfortable enough to come back, and being close, you know, living close here, obviously living in town, not having to come from out of town makes it even more convenient too. But the fact that they really cared, you know, and showed that they cared was a major point for me.
Yeah, you just knew that they cared and that they wanted what was best for you and that you were safe here. You know that they really care, and I'm not saying people don't care elsewhere, but here and being in this community, that you just know that they care, and they care about how your experience is from beginning to end.
Knowing a friend had it and was going through treatments roughly my same age really kind of strikes you and makes you want to try to do the preventative measures.
And that's what I had a really good friend who he had put off doing his colonoscopy until I think he was 52 maybe at the time. And he did have colon cancer and he was going through all the treatments. And, he was very big advocate. He would have given anything to be able to stay more active with his kids at the time. And he was going through treatments and everything. And let's get that done because I don't want that to be us. It's not as bad as people make it out to be. The prep is not fun, but the peace of mind as you leave and okay, I'm good. Or if I'm not good, I know they'll be here to help me with whatever the next steps are. It's one of those things, get it done. There's just no reason not to. And especially if you can do it with someone, why not? It's the little things along the way that make life fun. So we're so lucky to have it. I mean, there's so many communities now that are losing their hospitals or they don't have anywhere to go. And we are so lucky to have all these talented professionals here. And I think we can't take that for granted.
And so I was just going to say, you can't take for granted the care you get, just being able to have it available for you here. I mean, that you don't have to drive any further than here to get something like this done. And the preventative measures, go a long way. The peace of mind, I think we brought that up before. We can't beat that and put it into words how important it is to stay on top of the maintenance of your body.
And who wants to be in a car for an hour on your way to a colonoscopy?
Yeah, true.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.